It's wonderful to see so many people in person and so many good friends. I have the somewhat humbling job of being able to put some closure on today and hopefully a charge for tomorrow. But this is actually not fully the end. For those of you who are interested and especially in hearing about NIH priorities or talking more to the NIH leadership who's here, there's an NIH session following this in the laureate room, which is on this floor. So I would encourage people to attend that. And then there is a reception that starts at 5, from 5 to 7. So please know that there's time to continue with the networking before everybody comes back and engages for tomorrow. So if I could just introduce myself, my name is Naina Harawa. I am a professor here in the Department of Medicine. I am also a professor about 15 miles southeast of here at Charles R. Drew University of Medicine and Science, where I work with Dr. Spencer on the Drew Cares initiative. And then with CHIPS, I proudly co-lead the Policy Impact Core with Ayako Miyashida, who is home with a sick kid today, but hopefully will be here tomorrow. I don't have any slides, but I'm just gonna share some thoughts and some remarks. I would encourage, though, everybody who hasn't done it, resources for our core as well as for many of the other cores are available on the CHIPS website. So I would encourage you to take a look at those. So as we move into toward the end of day one of this conference, I've been reflecting a lot on my time in HIV, which started with a volunteer job nearly 34 years ago. But I'd like to take you back to about 1997, because it was in the late 90s, maybe a little later than that, when it became clear that science had identified effective strategies for long-term HIV treatment. And it was then that I was in the midst of my PhD program and happened to be talking career options with a physician father of a friend of mine. I felt passionate about my work in HIV and the need for scientists like me who were focused on the present and growing racial and ethnic disparities in HIV infection. But my friend's father surprised me because he told me I might want to consider a different career. He pointed to these miraculous new treatments and the possibility that HIV may not be a problem in a few years. That took me aback. I thought about it for a while, but I couldn't tell why. I couldn't necessarily argue exactly why, but I was pretty sure he was wrong. And unfortunately, now 25 plus years later, it's clear that he was wrong, because despite even greater biomedical advances, and it's hard not to be struck by all of the biomedical advances that have allowed many people, even in this room as well as elsewhere, to still be here, living and thriving and healthy with HIV, and to effectively prevent HIV with a pill or a shot. I'm struck by the way that HIV is led in the development of the science of community-based participatory research, and as we've heard so much today, we've also led in highlighting the need for the community to be front and foremost in how the research is thought about, done, and implemented. But it's impossible to not reflect on that, not to look out at all of you, and not be awed by the power of science, but also humbled by it. Because despite all of those advances, despite all of that great knowledge and all of the tools that we have, we're still sitting here far from our goal of ending the epidemic, and wondering how it is that we can invest even better the resources that we have at our disposal now. I don't want to in any way take away from all the amazing work that people are doing. I think our speakers today have certainly made clear that those investments have been well spent, but there's still more work to be done. And so we have these new tools, but many of you are being asked to do more with less, and often with teams who are tired, traumatized especially by the epidemics of overdose and COVID, and sometimes disillusioned. We've heard a lot of people talking about being impatient, and we have to also remember that they are under attack, and actually that all of us are under attack. Because along with the successful efforts to roll back reproductive rights, gender-affirming care, other types of DEI is now also under attack. So we talked about, we heard today about the anti-LGBT legislation that has become more and more popular and unfortunately passing in many states, but the same is happening as well with anti-DEI bills. There were 65 introduced since 2023, and 24 states are currently weighing them. Such bills have already become law in 8 states. And again, I think many of us here may not be here in the roles that we were not in without prior DEI efforts, and we need to look in all the spaces that each of us occupy to see ways in which we can fight back and ways in which we can be reminded that these attacks, even when we think they're for somebody else, that they're also coming to us. And I think the last several years have been, unfortunately, a case study in that. As Ms. Jeanette reminded us just a little bit ago, it was a fight when they were trying to get HIV testing into the Cook County jails. It is a fight, so much of what it is that we're still doing. And it will be a fight. But any good fighter has a few great punches. My husband covers boxing, so I know a fair amount about that. And not only does that fighter have a few good punches they can throw, in addition, they're able to get back up after being knocked down and keep fighting. So as I think about how we're going to move into tomorrow, I want us to be reminded of some of the lessons that I think we heard today. There were a bunch of them, so I'm sure I didn't get them all, but I just want to highlight a few. One, keeping the voice of the community front and center and keeping our own love for the community key and core to our work. I so appreciated the quote that Ms. Jasmine shared earlier today, and I tried to look up some boxer quotes, and one came supposedly from Muhammad Ali, in which he talked about service is the rent we pay for our place on earth, and so we need to keep that in mind, but do that service with a heart of love. 2, we need to think about how is it that we can keep empowering the people that we are working with, whether we're the scientists or we're the community members. We have to be clear about how it is that power is distributed and when it is that we need to relinquish that power. We need to think about ways in which our established and often preferred methods in science might contradict community priorities. I heard that things like controlled trials and blinded methods often don't make sense for our community partners. So how is it that we can work in communities, do our work, and still be of some service to groups that may end up not getting that intervention that we're testing or that our community partners are excited about. We need to establish relationships with people when there's opportunities. So obviously when people are in incarceration, that's one opportunity, but there are other opportunities as well. For example, when somebody is in a residential recovery facility, when somebody's getting a mental health treatment. So we need to think about what those relationships are and use them as settings for establishing new trust by being trustworthy ourselves. And finally, we need to be reciprocal as possible. And some of that means that as scientists, for those of us who are scientists, we don't always need to start big. We may be way up in our institutions and used to getting the RO1s and the UO1s and the big awards. But if we're starting with a new partner, like Dr. Morimoto said, we need to start small and really think about how is it that we can build that relationship, maybe with smaller things. And as our own relationship of trust and reciprocity happens, we can hear from the community about what's the big thing that they really want and need and implement it. And so with that, I just want to encourage us all to keep in mind ways in which we can keep up that fight and keep in mind the tiredness that some of our community partners or our team members might have. And as we move into tomorrow and this evening, ask ourselves 3 things in terms of taking advantage of this precious time that we have in one space. Who is it that we need to meet here that we haven't met yet? Who do we need to meet and learn from? Is there somebody who needs to meet us maybe and hear from us? And can we speak up and use our voice in ways that perhaps we haven't before? And finally, what are new and creative ways that we can bring new energy to this fight? I want to take maybe just my last thought is I want to commend the group that presented in the last panel up here and showed all of the murals, because I feel like for me, art and creativity are one of the main sort of life springs of new energy. And I have a family of artists. I am not one, but I think that when we do work that people think might be impossible, or we use new strategies within our science, we are enacting our own kinds of creativity. And by working and taking opportunities to be renewed by creative people like artists and singers and dancers, we also can get some of that energy back ourselves. So I want to thank everyone for being here and encourage you to enjoy your evening.